This is the third video of the series Quality Improvement Workshop, in which we will describe in detail different steps of the quality improvement process, with some useful examples. For more videos, visit my Facebook page, Healthcare Quality. Steps in quality improvement process are, in general: 1. Identify a project. 2. Establish the project. 3. Diagnose the cause. 4. Remedy the cause. 5. Hold the gains. 6. Replicate results and nominate new projects. For the first step, identify a project, please refer to the second video of this series. In the second step, establish the project, we have prepare a mission statement, select a team, and verify the mission. Prepare a mission statement. The mission statement is the written instruction to the team selected to tackle a quality improvement project. It describes the problem to be resolved, what's wrong, and the objective of the project, that is, what the team is to do about the problem. Quality improvement often requires teams composed of cross-functional groups of people who share the problem and represent various places in the workflow. For example, to remove delays in the process for taking X-rays, a team would at a minimum have members from a nursing unit, transport, radiology, and the medical staff. Guidelines for team selection. When selecting a team, the Quality Improvement Committee identifies those parts of the organization that are associated most closely with the problem. There are 4 places to look: where the problem is observed, where sources or causes of the problem might be found, among those with special knowledge, information, or skill in uncovering the root cause of this particular problem, and in areas that can be helpful in implementing the remedy. Once the Quality Improvement Committee determines what parts of the organization will be represented, it selects an individual team member from each. Each person should have direct, detailed personal knowledge of some part of the problem, and time for team meetings and between meeting assignments. Finally, as a group, team members should be able to understand the problem fully and work with their departments to implement the remedy. This implies that most team members should be managers, supervisors, or experienced individuals with significant responsibility. As needed, the team can draw on the specialized knowledge and experience of respected external or internal consultants. The team charter. Besides a mission statement, many teams also receive a charter detailing specific team responsibilities and giving the team the authority to carry out its mission. Typical provisions of a team charter are described below. The team is authorized to collect relevant data, discuss the problem with those involved with it, and develop a remedy. Team members are asked to spend a specific amount of time on the project each week, typically 4 hours, but often more. The team has access to the resources it needs to carry out the mission. Diagnose the cause of the problem. In this step, we have to analyze symptoms, confirm or modify the mission if needed, formulate theories, test theories, and identify root causes. Diagnosing the cause of the problem is a journey from a problem symptom to its root cause. Along the way, the project team investigates symptoms to find out why a problem is occurring. This is analogous to physicians' use of diagnostic procedures to uncover the cause of a patient's symptoms. In both cases, it's important to establish cause before prescribing a remedy. If cause is not established, the remedy will probably be ineffective and the condition will continue or become worse. Analyze symptoms. We begin the diagnosis journey by analyzing symptoms. This helps us understand fully the nature and the extent of the problem to be solved. In order to analyze symptoms, we have 3 steps. 1. Develop operational definitions. 2. Measure the symptoms. And 3. Define boundaries. Develop operational definitions. Often definitions are needed to ensure that all project team members have the same understanding of the mission statement. Examples. In the mission statement, we wrote, reduce the number of late discharges. Definition required for late. And if we write, eliminate inappropriate placement of ventilator patients in the intensive care unit, we have to define what we mean by inappropriate. The third example is improve patient satisfaction with waiting time in the outpatient clinic. We have to define what we mean by the word satisfaction. It's important to spend time ensuring that team members agree on the definitions of key terms related to mission statement and project, because it helps to prevent false impressions and often saves time later on. All definitions should be copied and given to each team member. As new definitions are developed during the course of the project, these should be added to the glossary and distributed to the team. If you are in doubt about a definition, question other team members about their understanding. If you think others are in doubt, your asking for clarification may help them. Measure the symptoms. All quality problems have symptoms that can be objectively measured to determine the scope of a problem. Sometimes symptom measurement already exists. At other times, your team will need to develop measurement before proceeding. The appropriate units of measure maybe time, years, months, weeks, days, hours, or minutes, or costs of poor quality in dollars, or defects, number of defects as percentage of all occurrences. Data collection. We have to plan for data collection. Each of the following is important in a data collection plan. 1. Design the data collection. 2. Describe the data required. 3. Decide where to collect the data. And 4. Train data collectors. Options for data collection might include research of existing records, direct observation, personal interviews, telephone interviews, or mail surveys. Analyze the results. The data must be tabulated and the results displayed. Theories cannot be tested by numbers alone. The data must be analyzed and conclusions reached. Various diagnostic tools are helpful in this analysis. Define boundaries. While definitions and symptom measurements help bring the project into focus, defining the problem boundaries establishes the scope of the project, where the project begins and ends. To define boundaries, your team might ask, does the project addresses all aspects of a problem or just some of them? Defining the project boundaries should be based on 3 factors: evidence in the data, the size of the project, and the beginning and end points. A. Evidence in the data. Examples: frequent late starts for outpatient surgery, but few for inpatient surgery. Or many instances of missing records at a central lab, but few at satellite labs. B. The size of the project. When boundaries are defined, the need to divide a project into smaller units may become apparent. For example, suppose a healthcare facility has 5 outpatient clinics, and data show excessive wait times at all of them. Because each clinic has its own operating processes, a single project team might not be able to improve wait times at all clinics simultaneously. After a team has improved the process at one clinic, other teams can use the lessons learned from the first project to improve each of the remaining clinics, either individually or as a group. Formulate theories. A theory is simply an unproven statement of the cause of a certain condition. When determining the cause of a quality problem, a project team must speculate about its many possible causes. Jumping to conclusions before considering many theories and provide which are correct would be risky. Brainstorming is a quality tool that's very useful at this point because it helps the team to consider a full range of theories about possible causes. Then, when we analyze data, The team must answer 3 questions. Which theories are supported by the results? Which theories are eliminated by the results? And what new theories are suggested by the results? Then we come to the step, remedy the cause. In this step, we have evaluate alternatives, design remedy, design controls, design for culture, prove effectiveness, and implement. Evaluate alternatives. The remedial journey to solve a quality problem begins by deciding on the best remedy. Since all possible solutions are not equally good, the team must consider a range of possible solutions and agree on the most effective and appropriate remedy. Brainstorming is often helpful at this point. Evaluating criteria. The most common criteria for evaluating alternatives include total cost, impact on the problem, benefit-cost relationship, cultural impact, resistance to change, implementation time, uncertainty about effectiveness, and health and safety and the environment. Total cost. Costs to implement a remedy should not exceed available resources. Usually quality improvement lowers costs, but some initial investment may be necessary. Impact on the problem. Some remedies may solve more of the problem than others. Benefit-cost relationship. The cost of each alternative compared to its impact on the team mission is even more important. Index should be more than 1. Cultural impact. Resistant to change. People frequently fear the impact of the new and untried. When evaluating alternatives, the team must consider the impact of each proposed remedy on those who would be affected by it. Possible resistance is not sufficient reason to rule out a remedy, but it should be weighed with other factors. All other factors being equal, the remedy likely to provoke the least resistance is preferable. Implementation time. The team tries to assess the time it will take to implement the remedy and weigh this against the urgency to reach a solution. The greater the urgency, the more important the time element. Uncertainty about effectiveness. A remedy may require untested technology or major organization changes. Even if the costs are relatively low and the potential payoff is high, the uncertainty of that payoff may be too great. Expected value is equal effectiveness multiplied by uncertainty probability. That's to say, from 0 to 1. Health, safety, and the environment. The environmental impact of a proposed remedy should at least be neutral and, if possible, positive. Quality tool, remedy selection matrix. Here is a matrix for evaluating alternatives You can use it to assess each proposed remedy according to the evaluating criteria. In this matrix, selection criteria are placed in the left column, with 3 columns representing different remedies in which we put an evaluation score. The summary rating can be obtained either by assigning a numeric weight to each criterion and calculating an average. Design the remedy. Once the team selects a remedy, it designs the remedy by performing 4 tasks. 1. Ensure that the remedy achieves project goals. 2. Determine the required resources. 3. Specify the procedures and other changes required. And 4. Assess human resources requirements. Ensure that the remedy achieves project goals. The team may need to review project goals to verify that the remedy will achieve desired results and that all team members are in agreement on this point. This is a final check before moving ahead. Determine the required resources. These resources include people, money, time, and material. Specify the procedures and other changes required. Before implementing the remedy, the team must describe explicitly what procedures will be required to adopt the proposed remedy. The team must also describe what changes need to be made to existing organizational policies, procedures, systems, work patterns, reporting relationships, and other critical operations. Any surprise down the line may sabotage the remedy. Also, we have to assess human resources training requirements. Often, it will be necessary to train or retrain staff. The team must explore fully all training requirements as well as the training resources needed. There are several quality tools useful when designing a remedy. These include the following: flow diagram, tree diagram, planning matrix, and planning network. Flow diagram. This visual representation helps the team clarify the proposal, identify any gaps or ambiguities in the design, and explain the remedy to others. We will speak in detail about developing flow diagrams while discussing quality improvement tools. A tree diagram identifies the tasks necessary to implement a remedy, but it doesn't describe the sequence in which they must be completed. This is an example of a tree diagram that outlines the steps for implementing a remedy by listing all the basic tasks needed to achieve that outcome. In this diagram, the main task, which is developing a medical record tracking process, is divided into 4 main tasks. Use new out guides, use new medical record covers, computer prints out same day, appointment slips. Medical record staff inserts same-day slips and use them. And each of these tasks is divided into other detailed tasks as shown. For example, use new medical record covers is divided into design new covers, order and inventory covers, and install covers. A planning network, on the other hand, displays the sequence of the tasks and help a team determine appropriate dates for completing each task, identify how long each task should take, and monitor progress in implementing the remedy. The planning network is a series of boxes connected by arrows. Each box indicates start and end dates for a single activity. The arrow from the right side of one activity to the left side of a second means that the second activity cannot start until the first one is completed. In this planning network, the sequence of the tasks are displayed. Some tasks couldn't be started except after other tasks are accomplished. Like electricity preparation is followed by room painting, then electricity finish, followed by room security and fixing cabinets, while other tasks could be started from the beginning of the project, like training nurses and doctors who will begin their jobs after the system is established and just before system test. Design controls. When quality improvement reduces deficiencies in existing goods, services, or processes, the result is frequently referred to as breakthrough. To ensure that the breakthrough is maintained, the quality improvement team needs to develop effective quality control. To build feedback loop, the team needs to provide the means to measure the results of the improved process, establish the control standards for each measure, determine how the actual performance will be compared to the standard, and design actions to be taken to regulate performance if it doesn't meet the standard. Here is a diagrammatic representation of the feedback loop as described. One, provide a mean to measure the process. Example, if a project reduces the waiting time in outpatient radiology, that waiting time must be continually measured so it can be evaluated against performance standard. Customer satisfaction with waiting time might also be measured. While it's important to measure end results or outcome, in-process measures are most helpful for identifying potential trouble spots. It's always easier to head off trouble than to clean up after a problem has occurred. 2. Establish the control standards. Quality control standards are based on actual performance of the new process. They reflect both the typical level of performance and the amount of variation in the performance. These standards, which describe the maximum natural variation of the process, are usually called control limits. Examples: waiting time for outpatient radiology, average 10 minutes, and the average waiting time for any day will not exceed 15 minutes. Post-operative wound infections are kept to fewer than 0.5%. 3. Determine how actual performance compares to the standard. One of the most common and effective quality tools for comparing actual performance to the established standards is the control chart. The control chart displays the measured performance of a process at a given time. Its control limits show how much variability is normally found in the process. Thus, a control chart helps determine whether a measured performance has drifted from the average to a point where corrective action is required. 4. Designing actions if performance doesn't meet standards. When performance doesn't meet the standard, you need to design a plan of action to bring the process back within its control limits. Developing such a plan of action requires careful analysis. When planning control systems, it's usually helpful to complete a quality control spreadsheet. This shows an example of quality control spreadsheet in which the control variable is minutes in waiting time. How measured? Difference between appointment time and time seen by the physician. Where measured? Reception area. Standard 7 minutes maximum. Who analyzes? Receptionist. Who acts? Clinic administrator. What's done? Check staff and equipment status. Check status of changing rooms. Advise technicians and radiologists. Design for culture. As we noted earlier, quality improvement means change. Sometimes many people resist. To plan for resistance, it's helpful to identify all likely sources of resistance, called barriers, and support, called aids. Rate the barriers and aids according to their perceived strengths. Identify countermeasures needed to overcome barriers. Developing a barrier and aids chart can be helpful at this point. Barriers and aids chart. Brainstorming is a useful tool for identifying likely sources of resistance. Then, with knowledge of the organization, its culture, and the process to be changed, the team can identify those factors they believe will be major barriers to implementation. Here is an example of the barriers and aids chart, where the major barriers are placed at the top, followed by aids, and then countermeasures. The desired effect is placed on the right side. Hold the gains. In this step, we have to design effective quality controls, foolproof the remedy, and audit the controls. After all its efforts to improve quality, a project team needs to be certain that the gains continue and the problem doesn't recur. This step encompasses 3 activities: design effective quality controls, foolproof the remedy, and audit the controls. We already talked about quality controls. Foolproof the remedy. Here are a few tactics that can help to foolproof a remedy. 1. Design systems to reduce the likelihood of errors. 2. Replace human sensing with technological sensing. 3. Keep feedback loops as short as possible. 4. Use active rather than passive checking. Systems to reduce likelihood of error. Examples: make it impossible to attach the vacuum line to an oxygen outlet by installing different sizes or shapes for vacuum and oxygen connectors. Ensure that all needed data are entered into the computer by making it impossible to move on to the next transaction until all data are entered for the present transaction. Decrease the likelihood that a needed item is left off the surgery cart by pre-packaging kits of instruments and other surgical items. In technological sensing, our examples are: a thermometer is a better go-to temperature than a hand held to the forehead. An echocardiogram measures heart function more reliably than using a stethoscope, and a date time stamp is more reliable than human transcription. The laser reading of barcodes is more accurate than manual entry of data by keyboard or paper and pencil. The reading and input of insurance numbers by optical or magnetic scanning is more error-free than manual entering. Using the computer to edit and cross-checking entries is more dependable than proofreading. Keep feedback loops as short as possible. There are 2 ways in which a feedback loop should be short. First, if checking is required, examine each piece of work as soon after it is complete as possible. This can prevent repetition of an error. Examples: many healthcare organizations use concurrent chart review, usually on a daily basis, to help ensure the quality and effectiveness of care. Computer entries are best edited as they are made, not later on in batch runs. Second is to report the results of checking directly to the individuals doing the work. Providing individuals with the means and authority to check their own work is the ideal way to keep feedback loops short. For example, boosting current wait times in a clinic provides direct and immediate feedback. Active with passive checking. Actively doing something is to check a result is far more accurate than merely inspecting it. For example, with blood donations, it's crucial that the identifying number on the blood bag matches the number on the sample tube that goes to the lab for testing and typing. A single person assigned to compare the two numbers might miss as many as 20% of any errors. If two individuals are assigned to compare the identifying numbers, one can check the bag while the other reads the tube. The first person is active and the second is passive. This method is more effective than the first. A third method would also use two checkers. Each would independently key the number for each donor into a small computer terminal that compares the number on the bag with the number on the tube. With this system, the error rate would be so small it might even be impossible to measure. Audit the controls. To ensure that its work continue to be effective, a team needs to include the following in its remedy: routine reporting of results, clear documentation of controls. Report results. Be certain that the ongoing results of the improved process are routinely reported to a level of management prepared to monitor progress and respond if gains are not held. Document controls. One way to do this is to develop a quality control manual that documents all the organization's quality control systems in terms of goals, measurements, and feedback loop responsibilities. Now we come to the last step in the quality improvement process, which is replicate results and nominate new projects. These activities ensure that an effective remedy for one problem is applied to similar ones, and that the organization continues to make improvements in the delivery of quality to customers. The Quality Improvement Committee ensures that the results of all successful projects are made known throughout the organization. It also identifies problems comparable to those that have been corrected and asks departments or teams to rectify them by applying the lessons learned. Opportunities for replication. In very large organizations, such as hospital systems and health maintenance organizations with multiple locations, similar processes are performed at each location. For example, administering medications, preparing patients for discharge, and logging test results in patient charts. Any process improvement in one clinical unit should be considered for replication in other units. In most organizations, even fundamentally different departments have certain activities in common. Each must return telephone calls, purchase materials and supplies, complete administrative reports, and so forth. Improvements made in one department for one of these activities should be studied for replication elsewhere. Replicating a quality improvement project is similar to the process for completing the original project, but replication can usually be accomplished much more quickly, sometimes in a matter of days or weeks. To replicate a quality improvement project, A team follows the steps used for an original project with certain differences at several points as follows. Find a process that needs improvement. The Quality Improvement Committee or other group makes the decision to support the replication in specific areas of the organization. Organized team. Team members consist of those individuals who are most familiar with and can best assess all facets of the particular process or aspect of care or service. Those are able to properly evaluate, aggregate, and display data and information. Replication teams are similar to other project teams, but because more is now known about the problem, they are likely to be smaller and exist for shorter periods of time. When establishing the project, the team is provided with documentation of the work and results from the original project. Diagnose the cause. The replication team validates two key points. Does the problem actually exist in the new situation? That the root causes of the original problem are at least significant causes of the new one. Select the potential process improvement. The remedy for the original problem should be adopted with only those modifications that are absolutely necessary. Wasting effort on redesigning a proven remedy should be avoided. With replication, the one factor that requires special attention is resistance to change. There may be additional resistance because the replicated remedy was invented elsewhere. Hold the gains. Teams asked to replicate a remedy benefit greatly from full, clear documentation of the original project. As you conducted your quality improvement project, remember that future replication teams will be customers for the documentation you create on your project. Often the original project team will be asked to assist the new replication teams. Good documentation of your project will make it easier for you to help. Nominate new projects. In the course of a quality improvement project, your team is likely to encounter new problems that should be addressed. As these are uncovered, the team should inform the Quality Improvement Committee. Project nomination usually comes from the following sources. When defining the scope of a project, the team typically focuses on the vital few causes and excludes the useful many. Often the useful many should be reconsidered for another project. As the team uncovers the root causes of a problem, other related but previously undocumented deficiencies may be uncovered. Example: when diagnosing the root cause of delays for surgeries, the team might discover that a high percentage of surgical supplies are spoiled when their outer packaging is opened accidentally or inappropriately. Although the wasted supplies don't contribute much to the delays, they clearly are costs of poor quality that should be eliminated. Sometimes a project team compares the root cause of its problem to root causes of seemingly unrelated problems and discovers they are linked to a pervasive common problem. Example: a team discovered that a primary reason for slow discharges from the obstetric unit has to do with new nurses assigned to the unit. The nurses have not been trained to coordinate the discharge of infants from the nursery with the discharge of their mothers. Meanwhile, other teams have learned that new nurses in other units have not received unit-specific training either. These complementary deficiencies suggest the need for a quality planning project to design unit-specific training for newly hired nurses and nurses transferred from one hospital unit to another. Thank you.